I'm Dr. Lindsey Tavakolian. I'm a plastic surgeon, and I want to share with you 5 surgeries that I would have done in my 30s, mom edition. So, some of us have spent our 30s chasing career goals, and others have spent that time building families. If that's you, and for all my moms out there who have moved through your childbearing years and are on the other side, then these procedures are for you. The first one that I would have done is a breast lift. So, in a breast lift, your whole breast mound and your nipple and areola are moved up higher on your chest into a more youthful position. Oftentimes, your breast will kind of deflate and it'll fall, and it just needs to be tightened, moved up, and you can actually get an increased fullness in appearance, even if you're removing tissue, just from bringing it all together, putting it up in a higher, more youthful position, and making the overall appearance more aesthetically pleasing. And one of my most common questions is, can I do this without a breast implant? And yes, you absolutely can have a breast lift without a breast implant. A quick exam on my part will tell me very quickly whether or not we can reach your aesthetic goals through just a lift alone, or if you need an augmentation, which leads me to the second surgery that I would have done in this mommy makeover era. And that is a breast augmentation and a lift at the same time. Now, whether or not you've had breast implants in the past, this is a great time to either re-up and get a new pair of implants, get the newest technology in implants, or get your very first pair and then get a lift with that. Most oftentimes, women who are post-pregnancy or post-weight changes will need a lift to get that breast to sit properly on the implant. And it's just a really rewarding procedure that can make a big change in how your body looks and the youthfulness of your body, taking you back to that pre-pregnancy, pre-weight gain feel. The third surgery that I would have done in this mommy makeover era, of course, is the tummy tuck. One of the most transformative procedures that we do in plastic surgery. It removes excess skin of the abdomen. If you happen to be lucky enough to have most of your stretch marks below your belly button, then you'll probably get most of those excised. And then when you look down after your surgery, you see a flatter tummy, less stretch marks. And then the second component of this surgery is I also bring the abdominal muscles back together midline, fixing erectus diastasis, which you probably learned about through your pregnancy era. And what this does is it brings your stomach muscles back together, strengthens your core, can help you support your core, relieving lower back pain if it's truly caused from that. So really a transformative procedure, and women are just so happy after this procedure. The fourth procedure that I would do in the mommy makeover era is a labiaplasty. So if your labia minora extend significantly past your labia majora, then chances are you have trouble with friction on clothing, friction during sexual intercourse, and even bulges in yoga pants. So this surgery is probably right for you if this sounds familiar to you and you're struggling with these things. It is important to have a labiaplasty with a surgeon who has respect for female sexual function, respect for the clitoris, respect for clitoral nerve function, and somebody who stays far away from that clitoral nerve during the surgery in order to preserve your sexual function, because there's no reason to sacrifice sexual function for an aesthetic or even a functional outcome, really, ever. The fifth thing that I would have done during this mommy makeover era is trade your C-section scar for a lip augmentation. And how is this possible? Well, I do a procedure where I do a dermal fat graft to the lips for lip augmentation, which results in a really natural appearing lip aug after it's healed. It takes a few weeks. And where do I get this dermal fat graft from? I get it from around your old C-section scar. So if you have a C-section scar that needs a revision, that's tethered to the abdomen, or is just a little bit wider than you like, then I can revise that scar and take tissue from the surrounding area and take it and graft it to your lips for a lip augmentation. It's a really great procedure. It's kind of like a 2-for-1 deal where you get 2 outcomes, 1 surgery. Now, ultimately, whether or not these procedures are right for you is going to depend upon your preference, your aesthetic goals, your timeline, my evaluation of your anatomy, and ultimately whether or not all of those things fit together and align. These surgeries are well suited for post-pregnancy or just post-weight gain and weight loss. As always, please ask questions, leave them in my comments, and I will do my very best to answer them.